Now, in the third section, we will talk about some investigations for the diagnosis of acoustic neuroma. And the investigation we will talk about mainly will be some audiological tests. Then we will talk about the stapedial reflex decay test, and then vestibular and neurological tests. First, the different audiological tests and what are their findings if the lesion is in the cochlea or in the retrocochlear area. So this chart is telling us all the description about different audiological tests that can be performed. So first, the pure tone audiogram. Person is normal, usually the test is normal. If the cochlear lesion is present, there is sensory neural hearing loss, and then in retrocochlear lesion also there is sensory neural hearing loss. Speech discrimination score is normal, is 90 to 100% in normal individuals, below 90% in cochlear lesion, and is very poor in retrocochlear lesion. So speech discrimination even in cochlear lesion is preserved, but in retrocochlear it's very poor. Rollover phenomenon is absent in normal individual, absent in cochlear, but it's present in retrocochlear lesion. Recruitment, absent in normal, present in cochlear lesion, and it's absent in retrocochlear. SI score is 0 to 15% in normal individual, over 70% in cochlear, and 0 to 20% in retrocochlear lesion. Threshold tone decay test, 0 to 15 decibel in normal, less than 25 decibel in cochlear, and above 25 in retrocochlear lesion. Stapedial reflex is present in normal, present in cochlear lesion, absent in retrocochlear lesion. Stapedial reflex decay, normal in normal individuals, normal in cochlear lesion, abnormal in retrocochlear. And then BERA, which is brainstem evoked response audiometry, normal interval between wave 1 and 5. In cochlear, it's also normal, and in retrocochlear, it's delayed or absent. So these are some very important differential points between the normal individuals, individuals with cochlear lesion, and individuals with retrocochlear lesions. Then stapedial reflex decay test. This is the test usually is done to find out the track for the stapedial reflex or acoustic reflex. And these are it involves mainly the 8th nerve, 7th nerve, and then it involves the superior olivary complex, in which the stapedial reflex acoustic reflex is done for it's also known as middle ear muscle testing also, and in which the contraction of the tympanic membrane is visualized, or muscle of the are visualized after loud sounds are after the loud sounds are produced. So this, if it's normal and contraction is done, or it's visible, it means the acoustic reflex is normal or is present. So stapedial reflex decay testing measure the pathway of that acoustic reflex pathway that involves 8th, seventh nerve, and superior olivary complex. Then the vestibular test it's a caloric test, will show diminished or absent response in 96% of patients with acoustic neuroma. So caloric test is also performed, which is diminished in 96% of the patients. When tumor is very small, caloric test may be normal. So if tumor is very small and it doesn't affect, then the vestibular test is normal. Here if we see, this is the area cooled in lateral semicircular canal. So in this cold water is applied to the lateral semicircular canal. From there it goes to right vestibular nerve and then nucleus, right vestibular nucleus. Then we have right abducent nucleus, right oculomotor nucleus, and then it goes to the rectus muscle, and then as a result of this vestibular test or caloric test, there is slow movements and then there is rapid movement in the direction of nystagmus, and there is slow movement in the opposite side. The neurological tests, examination of cranial nerves, cerebellar functions, brainstem signs of pyramidal and sensory tract. These are all the different neurological tests in which examination of cranial nerves, which are mainly affected, like we said, fifth cranial nerve, then we have 9th, 10th, 11th, and 12th. All the areas supplied by these cranial nerves are tested, and their motor function and sensory function is tested for all these cranial nerves. And then for cerebellar functions, we said we can do different tests like nose test, dysdiadokinesis, heel knee test. All these are the tests done for finding out the cerebellar functions. Fundus is examined for any blurring or papilledema, if it's present or not. CSF examination, usually the protein level is raised in cerebrospinal fluid, and usually the lumbar puncture is avoided because of high intracranial pressures. High intracranial pressure is a contraindication for lumbar puncture, so usually it should be avoided to perform lumbar puncture. Pure important tests are pure tone audiometry, then we have speech discrimination score, rollover curve, stapedial reflex decay, evoked response audiometry, and MRI with contrast. These are some important tests done to find out the acoustic neuroma. Thank you for watching sqadia.com.